Hi, this is Dr. Catherine Dow. I'm reporting on the American College of Rheumatology 2022 conference for Rheum Now. And here with me is my guest, Jarena Lim. She's actually a medical student, third year here at UT Southwestern. And she's going to be talking to us about her abstract. Welcome, Jarena.
Thank you, Dr. Dow. Thank you for having me. I'm really excited to be here.
So your abstract number is 0220. And it's about social media use in academic rheumatology. Tell me about it.
That's correct. So as a third-year medical student, I was working with Dr. Dow on this study of social media in academic rheumatology. Dr. Dow has done a lot of research on social media and its role in medicine, and our study specifically was evaluating the use of social media among rheumatology professionals at UT Southwestern.
What did you find?
Great question. So we sent out an online survey to healthcare professionals, researchers, and trainees within the Rheumatic Diseases Division at UT Southwestern, and we were trying to identify current trends, beliefs, and practices regarding social media. And so from this survey, we found several different things. We found that the majority of the people using the social media were between 40 to 50 years old, and Facebook was the most popular platform among them. We also asked them about their top reasons for using social media, and this included entertainment, for friendships, and also to learn about current trends. Other things we found were that 84% of respondents believe that social media has a role in medical education, which is an overwhelming majority. However, only 33% of these people have actually used social media to enhance medical education. Now, this disparity, we wanted to know what was the reason behind why not many people might be hesitant to be using social media for medical education. And so other questions we asked about was how respondents felt about their proficiency with social media. And this was interesting. Only 5% of people rated their proficiency as excellent. 59% rated their proficiency as good, and 33% rated their proficiency as fair. In addition to that, we also were able to learn about people's reasons for not using social media. And this included privacy concerns, viewing social media as a waste of time, as well as the validity of information that is out there on social media.
Right. So do you use social media to enhance your medical education?
I do. And I think before this project of working on this abstract, I don't think I realized how much I was actually using social media to enhance my education as a medical student. I follow a lot of different doctors on different social media platforms, and they use their platforms to educate not only medical students, but just the general public about different trends in medicine, new topics, and exciting things going on in research, as well as just different topics that are very high yield to know for medical students as well. And I think they're really great because they condense these topics down into very short messages that help you capture the highlights of what you need to know. And I really feel like that I learn a lot from them. And I don't think I was realizing how much they were benefiting me until I started to think about it.
What kind of tips would you recommend to your fellow med students and people who want to incorporate social media into learning about medicine?
Great question. I think there's a lot of possibilities for anyone who is interested in starting to incorporate social media into their practice, whether or not they're a medical student or a resident or attending. I think just getting started on whatever platform you choose is and starting to connect with people that you are interested in, following them and seeing how people use their platform is one way to start learning. I think it's a great idea to start educating yourself on how to use social media. I know there is a lot of hesitancy out there. So just learning from others and how they've been able to navigate this sort of new area that is going to become more and more prominent, I think, in medicine. Just one way to get started. And as medical students right now, I think for medical students specifically, just starting to maybe practice for the future and where you want to educate people in when like we become physicians, I think we can start practicing just sharing what we know and maybe allowing other people to look into a glimpse of our lives and how we are navigating medical school right now.
I think you're right, and that's very important. I mean, employers and, you know, your residency directors, your program directors for fellowship, they look at your social media profile. My tips to medical students is, you know, number one, keep it clean. Number two, make it accurate. And number three, to disseminate good information, not bad, because you really could use this to educate the public, to really enhance your voice. And it's amazing because, you know, I learned so much from Twitter. I learned so much from, you know, different platforms, like you say. Right now, the American College of Rheumatology, the tweet storms are crazy. I mean, it's everywhere. I've been tweeting like nuts. And so it's one of those things that, you know, unless you try it, you don't know how exciting it is. So, you know, I have a Twitter account. Mine is at KDow2011. And then what's your Twitter account, Jarena?
Mine is at JarenaLim925.
So I want everybody to follow us. And I also have a TikTok account, believe it or not, over 10,700 followers, and I educate the general public about rheumatology. So thank you so much for your time, Jarena. And this is Dr. Catherine Dow reporting for Rheum Now.
Thank you so much, Dr. Dow.